So now I'm going to go over all of my, as if I was going to admit this cat into the clinic. It happens to be my cat. We're going to do dental today. So I have my consent form that I would fill out. Typically we would write down on here, we would do a dental. It's our consent form and all of that. So then we would discuss if we were going to do any blood work ahead of time, an IV catheter, and then the client, or myself in this case, would sign date and then put a phone number and email and which way we would want contacted. So that's essentially my consent form. And then typically on admit we also have a medical care plan, which would be our estimate. So just what it would cost to have, you know, teeth extractions done, the anesthesia, and it just breaks it down for the client. So we have them sign that. And then basically our way of making sure that each pet is getting done what it's here to get done with. We have cage cards, and all of ours are a different color. So our pink one is for puppy and kitten admits. So if they're here for just vaccines or something as a puppy or a kitten, they would get the pink card. Yellow is our anything else that needs to be done if a technician needs to see them, that kind of a thing. Again, admitting for vaccines. The difference between these two is that typically these guys are younger, and so we need to watch them a little bit more closely since they probably haven't seen the vaccines before. The white one is if they are boarding with us, they don't need anything special. The purple is for patients that are sick, whether they're coughing, they've got an ear infection, a urinary tract infection, whatever, they get this one. And the blue, we work really closely with the rescue, so if we have any of those admits here, they get a blue card. Typically they are in isolation because we're not sure on vaccine status and health status. And our green one is for surgery. So I have this one set up for my cat who's here for his dental. Basically it's a card that has his weight, his age, his name, his birthday, what he looks like, of course my information as well, and then what he's here for. So he's on for surgery and dental. On these it would also be, you know, let's say we have a sick patient, admit would be on top, and then it would be coughing, if that's what we were going to do with those. So that's basically how we ensure that each patient is here and getting what it needs to have done, especially our surgery patients. And then as far as the lab form, typically we send them with the consent form and it says on there what we're going to do. Otherwise we have our travel sheet, which would also go with. And there is a lab section right here. So if we pulled blood and needed it ran, we would mark it on here that it needs done and give it to the lab, and then they would bring it back to us. And each one of our, I didn't bring one in, but each one of our surgery patients or admit patients has a drawer, a plastic drawer with their name on it. Basically just keeps all their stuff together. Here is our anesthesia form. So I already have this one filled out. With the drugs that we would use, you know, if we were going to do any antecedent, again, blood work, catheter, that stuff would get all marked on here, as well as a physical exam prior to surgery, with all that information on there as well. And on the back has, you know, if we pulled teeth, we would be able to log it here, and then just regular vital signs we would be able to monitor here as well, which you'll see later in the video. And then as far as discharge, we have a general discharge form, but we go through and check and highlight the ones that are important depending on each surgery. So special instructions, and then we typically have 2 copies, one that the client signs and dates, and then so we keep one for our records, and then they take one home for them. So we know exactly what got told to them and that kind of a thing. So that would be all my forms. I didn't mention with the other ones is our medical records. So ours, we are totally digital. So all of our records are in here, including vaccine and then any previous surgery or sick times. He hasn't been sick when he's been here, but we can go to like our lab tab and look up any blood work or stool sample or anything like that. We can always go to our vaccine tab, which shows all the vaccines that have been done and when. And then just the chronological order. So we use AbbeyMark as our system here, and that's how we keep track of our personal records. Yeah. Okay, so now I'm going to go through our discharge form. I kind of touched on it earlier, but with our discharge form, we have different recommendations depending on what's going on. So in this case, this one is about today and tomorrow, or today and tonight. Protect by leaving the hospital by using either a leash or a carrier. This is a cat. Dental, so he's going to be in his crate. And then until tomorrow, keep your pet quiet and confined in a warm environment, off of furniture, off of high places where they could fall. Being a cat, he would jump up and he could possibly fall if he was still a little under the effects of the anesthesia, so we want to keep him down off of things. No running, jumping, access to stairs. Again, same thing as what we talked about earlier. Being in a small room for about a day with that kind of stuff, it should have wore off by then. And then we talk about diet. You know, he may not want to eat, or he may want to eat and drink a lot. We kind of want to not let him do that because he could get sick and that kind of a thing. So then just small meal tonight and then resume normal tomorrow. He's going home with some pain meds. It's an anti-inflammatory Onsior. He's supposed to get 1 tablet once a day until gone. We're only going to do about 3 days of that. So with that, in the special instructions, you know, we don't want him to get any steroids. The anti-inflammatory and the steroids, they don't mix. They make the liver unhappy and that kind of a thing. So we'll have to, you know, we'll talk about that. He doesn't have any suture, so as far as a surgical site, we don't have to talk about that much. He's not going to go home with any bandages or any collar. Again, it was a routine dental, so nothing like that. And then we have on here to see him back in about 6 months for a complimentary dental exam. Make sure his teeth is still looking healthy and all of that. And then they're advised to call back with any questions, concerns, anything like that in the next, you know, whenever they need to. And then again, in the special instructions, you know, not to give steroids or any other medications until the anti-inflammatory, the Onsior, is out of his system. Now I'll show the jugular hole. Apparently he's a star at this. So I'll hold his head up and kind of to the side if we were going to pull out at this one, the left side. That's kind of the jugular hole. So for the cephalic vein, I'll put my hand here and I will roll the vein out. And I'll hold his head. And that is the cephalic vein hold. So now I'm going to hold off for the medial saphenous vein, and I'll gently put pressure back here and hold the legs straight, and they'll be able to draw blood right down in here. Okay, so now I'm going to show you how to move him into and then out of his kennel safely. So Hiram will come in here. Come on, kennel up, buddy. Good job. Take his leash off, and then I'll shut it in, and that's moving him in, and then I will put his leash back on, bring him out, and we'll get him ready for surgery. So now I'm going to show you how to safely apply a muzzle. So I will come from behind, place it, and then I will buckle it behind his ears, and I will pull it tight, and there's the one. Okay, so now I'm going to put an e-collar on Hiram here. I pre-cut a length of gauze that I was pretty sure would fit. Hiram, sit, stay. poses around him to kind of measure and see where this would fit at on him. Hold still. Ready? So it looks like about there. Here. You want the cheese? Sit. Good boy. Stay. So. Get this put together. Sit, please. Good job. And I'll thread my gauze through. Okay, so now that I got my gauze put on, we'll carefully slip it over his head. And I will tie the gauze so that he can't get it off. And that is how you apply a e-collar. So now I'm going to do a physical exam on Hiram. I'm going to get his temperature, find his pulse, and get a respirate. And then at the end I'll give him kind of an ASA grade. So I'll get his temperature here, have my thermometer, and some lube. Okay, and his temperature is 101.6. Put that over there to clean him a little bit. And then I will feel for pulses back here. And those all feel normal back here. We'll get his rest and listen to his heart. His heart sounds good. Okay, that all sounds normal. His respiratory rate's about 25. And then I would give him an ASA grade of 1. I don't see anything wrong. He's pretty healthy and perky, and heart and lungs all sound normal, and his pulses feel normal. I'm going to do an exam on a cat. This one's name is Haas. He actually happens to be mine. So we'll kind of look at his coat and stuff, and he looks good. We'll look at his teeth, which he could use a cleaning. He's got yucky teeth. I will get kind of heart rate, respirate, those kind of things now. Stay here. His heart rate's about 120 and sounds good. His respiration rate's about 15. His heart and lungs sound good. There's no murmurs or crackling or anything like that. So I will get his, yes, I know. I will get his pulse here from his back leg. He's getting tired of me, but oh, you're fine. Both pulses in his back legs feel normal. So then I will get his temperature. She's probably not going to be a fan of. Is it for me? So I'm going to lightly scruff him, I think. So now I got to get his temperature, and I had to get some help because he was not the most cooperative for it. So Bria will gently scruff him and turn him for me. Oh, I know. So I will get his temp, wait for it to go off. It's almost done, buddy. Good job. Alright, so we're at 100.3, which is normal for a cat. So that's his exam. Okay, so with him and his health after his exam and everything, I would give him an ASA grade of 1, meaning he's perfectly healthy. Heart and lungs sound good. His temperature was normal. Pulses were normal. Skin coat, ears, teeth, the whole bit. I would say he's perfectly healthy. Now I'm going to pull blood out of the cephalic vein for Hiram. Holly is going to hold off and occlude the vein for me. I'm just going to wet it with a little bit of alcohol. And then I will find my vein here. And we'll hold off and I'll recap. There you go. Okay, so now I'm going to draw blood out of his lateral saphenous vein. So I have my alcohol. I'm just going to kind of wet the area. And then I will kind of push it up against my thumb so it doesn't roll out of the way. And I will go ahead and poke. Draw back, and then I'll hold off, and I got my blood out of the lateral saphenous vein. Thanks. Okay, so now I'm going to pull blood on Hiram out of his jugular. So in this case, I'm going to do his right, and Holly is going to restrain him for me, and I will be pulling. So first I will press here. I will wet it with my alcohol. I will occlude it myself. So I will feel it in there. And cap my needle. And there we go. Now I'm going to pull blood out of his cephalic vein. So Bree's going to restrain for me, and I got a tourniquet and some alcohol. So,
don't bite that way.
stop. So I'll kind of explain what I did, since he's not being the most cooperative now. You can let him down, Bria. I applied my tourniquet. I cleaned his leg up with alcohol to kind of scrub ahead of time. And then I inserted the needle into his cephalic vein. and pulled back, and I got my blood. Okay, so now we're gonna pull blood out of his back leg, his medial saphenous. Bree's gonna hold out for me. I'm gonna locate the vein first, which is really far forward. Okay, so then I'll grab my syringe. I kind of put it along my thumb so it doesn't roll too far out of my way. And then I will pull my blood. And Bree will hold off for me. So that is the blood draw on a medial saphenous vein on a cat. Okay, so now I'm going to pull blood out of his jugular vein. So Sarah's helping balance him, and he is sedated, so I have it held off. Wet down his hair. Then we'll hold off for a few minutes, and there's his blood from his jugular. This is Dr. Beeman. We're going to figure out our pre-anesthetic protocol for this cat. We're going to do a cat spay, and she was about 6.3 pounds, and we have charts for how we do our protocol here. So we're running down to 6, and so we'll do 0.1 for Dex Domator, right?
Correct.
We'll do 0.14 for ketamine, and then it looks like for Torb we'll do 0.05.
Sounds good.
So that'll be her, to knock her out, pre-anesthetic. And we do kind of a multimodal approach, so we don't have to do as many drugs, or as much of each drug. And then we'll do some buprenorphine or Buprenex injectable for some additional pain management. Okay, so now I am going to put my drugs in from my surgery into my controlled substance, my drug log. So we have our binder, our drug log, and then I have my surgery sheet and anesthesia form that has exactly what drugs we used, how much, that kind of a thing. So we used dextrometer, Torb, and midazolam. And all three, well, the Torb and the midazolam are in here. They're the controlled substance. The Dexdome, it's not. So I will flip to my page for the Torb, and then I'll write in the date that we used it, and then his name, which is Big Hoss, the client's name, the client number. He was a cat. I'll have my doctor sign here that I have to go find him, but I will have him sign this when we're done. We have an initial amount, the amount used, and then what we have left. So with the Torb, we had 4.71 left. We use 0.15, and I can't do that math in my head. So So then I'll go through and I'll fill in those. And then I will flip to the midazolam and I will do the same thing. Put in the date, his name. He was a kitty cat. Again, my doctor will have to sign. And I will get that as soon as I get a calculator. Okay, so this is our oxygen source. We have these and we have tubes going to our anesthetic machines, which we'll get to over there. And then this is my pressure gauge on my oxygen source. So then over here we have our anesthesia machine and cart. We have our oxygen that comes in here. We have a spare tank on here just in case with our oxygen pressure gauge as well. So we know how much is, the pressure of it coming in. We also have our vaporizer, which vaporizes a liquid anesthetic, which we use isoflurane, and it helps put that into the system. We have our flow meter and our flush valve here. Or actually, this is the quick valve here. This controls how much oxygen we have, or how much we put into the system. We then have our scavenging system, which pumps it out of the building. We have a exhaust fan over in this corner over here. That helps push it all out. We have our breathing tubes here and a kind of a wide piece that connects to the trach tube when we have that in, or one of the cones. And then we have on this side we have our CO2 absorber, and it just, like it says, absorbs the carbon dioxide that is put off by the patient, and then it of course goes through the scavenging system. And then on here I have a rebreathing circuit right now, and it helps with recirculation of the some of the expired gases. And then I have sitting over here our non-rebreathing, which is helpful in smaller patients for lower resistance for breathing. Okay, so now I'm going to perform a leak test on this anesthetic machine. So I'm going to, my main source of oxygen is on. I'm going to make sure there's a decent amount of liquid in the vaporizer, which there is. It's just filled. So I'm going to go ahead and close off the tube, turn on my oxygen, and then I'm going to close my pop-off valve completely. And I'm going to hit my flush valve and make sure that this level does not go down. So it went right back to where it was supposed to. So I don't believe there's a leak because of that, so I'm going to go ahead and slowly open the valve, and as long as that bag goes down, then I did it right. And since it's going down, I don't believe there's a leak in the system. And go.
I am Dr. Scott Beeman. I'm a 2010 graduate of Iowa State University, College of Veterinary Medicine, and I am Danny Applegate's preceptor.
Now I'm going to put in a catheter in his cephalic vein, in this case his front right. So I'm going to go ahead and clip the area above his vein. Want to get a lot of distance around, just make sure. And then I will take my alcohol. I will.
Yeah, I do not have any blood
Scrub it. Okay, so now I'm going to put his tourniquet on just to get him ready before I put his catheter in. And I've already clipped and scrubbed. So, and I have my tape here all ready to go. So I'll pull it out and I'll find my vein. And we'll go ahead and place it. Advance my catheter.
What is it? Oh, air paper. I mean, you never have any issues in your clinic, but we're having.
No, never.
Okay,
Never
so
have issues. People never get upset. Okay, so where is, sweetie? Yeah, actually, there's quite a bit of ear left.
I know, I think it looks.
Yeah, maybe it was laying up back and just looking a little bit.
so now that I have it flowing, I'm going to go ahead and tape it in. You're okay. Good job, buddy. All right. That looks good. So, now, Cabby, come over here. We'll get a close-up of our bag. It's running very well. So that is my cephalic vein catheter. Okay, so now I'm going to put a catheter in his lateral saphenous vein. Hannah is going to hold off for me, so she's just putting pressure on the back of his leg. And I'm going to clip and scrub it here. Okay, so I'll take my little bit of alcohol here. Nope, you're okay, Myron. Yeah, just like that. And then I'm putting in a 22 gauge catheter. So, I'm going to go ahead and line it up along my thumb just so it doesn't wiggle too far. I'm going to place my catheter. I will advance it, make sure it's in okay.
I am prepared today.
So I'm going to let,
That's great.
go ahead and let go there.
To go there.
So, I'm going to go ahead and tape it in. I'm going to tape off now. I'm going to go ahead and place my tape. Get my line. Make sure it's going to run okay. Okay, so then we'll go ahead and look at the IV line, which is running very well. So I know my catheter is working well. It's taped in, and there we go. Okay, so now I have all my drugs pulled up, my Dex, my Torb, and my ketamine. And I have it written down on the sheet, so we know. I'm going to go ahead and combine all my drugs. so I have my Dex. I'm gonna go ahead and add my Torb. And I'll add my ketamine. And then get all the air bubbles out, and now we have our IM injection ready for our Caspe. Okay, so now we're gonna go ahead and give her her IM anesthetic drugs. So I'm gonna gently scruff her and give her back leg to my veterinarian who's gonna give the injection.
I know.
And it burns.
I
So we're gonna
know.
let her fall
You're
asleep
right.
in there and then we'll come back. Okay, so now I'm gonna get some of my injections out of the way. I'm gonna give her her bupe. We're gonna go IM with this. So I will extend her leg, find her muscle. Hook in, draw back, and make sure I don't have any blood. And I'll go ahead and give that. And then she's got some vaccines, so I'll do those as sub-Q injections. So, again, I'll poke in, draw back, and then I'll inject. Okay. And one more. And then she also needs a microchip, so we'll just go ahead and give that as well. Pinch the skin and get a tint, and then I will inject there. And then I'm going to get her all ready to do her IV injection. Okay, so now I'm going to do an IV injection. I'm going to use her back leg because we had some attempts with catheters in her front leg. So I'm going to go ahead and scrub up her back leg. Scrub it a little bit with some alcohol. And then my lovely assistant Jill will hold off the vein for me. And this is just some lactated ringer. She didn't need any IV injections today, so. Okay. Got a rolly vein. So then I got my flash of blood. I'll have Jill lift up. And then I will give it, and we'll hold off and okay, so now I'm going to put some eye lube in. And I'll just put a little bit on the eye, and then I'll make her blink so it melts over the eye. And there's our eye lube. So now I have Dr. Beeman here. He's going to hold her mouth open for me while I put the trach tube in. So I'm going to grab her tongue, pull it out, and gently slide it in. And I will tie this on her. Tie behind her head so she can't slip it off at any point or can't fall off. And I will grab my, and we use isoflurane and oxygen, so I've got her hooked up to both here. And I will inflate her cuff so that it's kind of a pillow softness. And now our trach tube is placed. So now I'm going to find her bladder and express it so she doesn't, my surgeon doesn't have so much problem spaying her. So I'm going to squeeze down her abdomen. Kind of feels like a water balloon. And then I'm going to gently squeeze. And it's hard to see because of the towel, but trust me, she's peeing. Okay, so pea soaked towel. That will go in the laundry in a little bit. And now her bladder's expressed. Okay, so now that we have her hooked up to isoflurane and oxygen, so she's under anesthesia, I'm gonna go ahead and hook up all of our monitoring equipment. So this just slides down right along her trach tube. Till it stops, just there. And then I will hook up her pulse ox. Put it on her tongue in this case. And then I have her blood pressure. So I'll hook up the cuff to, I'm gonna do her back leg. Just Velcro it around. Turn it all on. And then our computer is actually across the way, so I'll get a video of that here in just a second. Okay, so now I'm going to get her all hooked up now that she's anesthetized and has her trach tube in. So I have my kind of 3-in-1 heart rate monitor, ECG, and temperature probe. And I'm going to go ahead and slide it in, pull out her tongue, and slide it right down along her trach tube. That'll go down her throat until it stops. And then I have her pulse ox, which I will hook up to her tongue. And then I have her blood pressure cuff, which I will attach back on her back leg, just because we're going to put a catheter in the front. Make sure that's tight. I'll turn it on, and our monitor is actually kind of across the way, so we'll get a short video of that here in just a second. Okay, so now I'm going to clip and scrub and get her prepped for surgery. So I'm going to find her xiphoid process, and we usually clip from there back, and just to the outside of her mammary glands. So go ahead and scrub. Of course, she's got really fine hair, so it's going to be kind of hard to clip. Okay, so then get as much of the hair off as I can. And I will go ahead and vacuum some of the hair up so that it's not everywhere. We use a shop vac. Alright, so then I have my 3 scrubs. I have my alcohol, my livodine scrub, and then my iodine solution. So I will do 3 of each. Well, 3 of each of these, and then alcohol in between each one. So I will start with my alcohol. And then we'll scrub the middle and into and out. start in the middle and then kind of go out. Do my scrub. I usually go out a little bit further to kind of wet the hair down so that it stays down during surgery. And you never go back into the middle. And I'm onto my solution here. And last one. And now she's prepped. Okay, so I'm supposed to show how we carry her and transport her. So, just supporting the head and the rest of her body while we move her into our surgery suite. Unfortunately, our surgery suite is out of commission at the moment. It's getting kind of a facelift. So we are doing everything out here on the prep table, but we will obviously be sterile. So I will rehook her back up with everything. Her pulse ox. And then I will there we go. Now she is completely ready and prepped. Okay, so now this is kind of our vital record on our cat that is getting her spay done. So we are watching her heart rate with our ECG. We are watching her blood pressure, her SpO2, her respiration, and her temp. So I'll record all of that here on our vital sign record. And so yeah, it is 12:45. Her rate's 160. Her blood pressure is 108 over 75 over 86. Her SpO2 is 87. Respiration is 40. And her temp is 98.4. So I'm now going to go probably adjust her anesthesia gas, her isoflurane level, bring it down a little bit so that her SpO2 will hopefully rise a little bit. And then we already have her on a heating pad, but I'm going to get another warm towel to put over her as she wakes up. So, okay, so now I'm going to demonstrate performing CPR. He's obviously not having any going into cardiopulmonary arrest or anything like that. But I'm going to just kind of explain. So I'll put my hands kind of right behind his elbow, about where his heart would be, and I would do 10 steady pumps, just steady and with a decent amount of pressure. And then I would come over, and again, he doesn't have a trach tube in, he is sedated, but and then I would squeeze this bag, and I would give him, my pop-off valve is closed, I have oxygen on, and then I would squeeze the bag to give him a breath, and then I would go back to the compressions. So that's it. Okay. Okay, so now I'm going to scrub. I already have my face mask and my hair net thing on. So I have my gown, my gloves, and then I have my brush and my towel here. So I'll take some of my surgery scrub, and I will grab my brush, and I will start scrubbing every crevice that I can.
up to the elbow. And I'll get my other hand. Repeating the same thing. I'll also go clear up to my elbow. Rinse. Grab my towel. I will grab my gown. Get my gloves on here. Okay. I'll have someone tie me in a minute, and I will pick. And then I will go ahead and organize his pack a little bit. Okay, so now I'm going to put my scalpel blade on my handle here. There we go. All right. So then as the scrubbed in technician, I have to help hand him what he needs and kind of blot some of the internal organs as needed. What do you need?
Add some forceps. Looks like it's hiding right over by the
Oh, yes, yes.
gauze there. Thank you. Nice cat to us.
Good.
Okay, the spay hook, please. Thank you. Okay.
Got a lot of fat in there. Okay.
All right, I can get a mosquito hemostat, please.
Yeah.
Chester Carmel's. Next, I'm going to need the suture.
Okay. Jill. Oh. All right.
Okay, suture and needle holder, please. Fat triangle right there.
That's good. You're running for a bit. You want this button? You want a bail switch?
Okay. This nice right here. Blot it for me. Make sure we don't have any bleeding. Looks good. Let me slide back in.
All right. Now we're going to go ahead and finish the spay. Okay, so now we've got our canine neuter here. I'll just position my light. I've already got him hooked up and tied down, so we're going to neuter this guy. Okay, so now we have our spay. My doctor will lay the drape, but I'll position the light for him. We've got her all hooked up and tied down, and so we're going to spay her here in just a minute. Okay, so now we moved him to the surgery table. I'll hook him up, pull socks and everything. Hook him back up. And then we intend to neuter this guy, so he's all flipped and prepped and ready to go. Now that my surgery is all done and awake, we now have to clean. So I will start by taking all my sharps and putting them in my sharps container. So I have my catheters, needles off my syringe. I have several of those. And then we have all of our stuff here. Just put stuff back where it belongs. My doctor removed the sharps out of the pack already. So those will go over to our sink to be washed. So now I've got a lot of the sharps taken care of. I got the pack put over by the sink, and I'll clean those in a little bit. But now I just got to clean up a lot of my other equipment. So I'll take some of my alcohol, and I will clean off my thermometer. I put it away, and then like my pulse ox, I'll clean that up too. I'll grab it first from here.
How are you, honey?
Okay. And then I'll also clean off my other piece of equipment here. And we'll get those all cleaned up, and then I'll spray off my table. Alright, so now I'm just going to spray off my area with my disinfectant spray, and it's got to sit just a little bit. So in the meantime, I will sweep here. Again, okay. So while that sits, I'm going to go ahead and sweep up a little bit. Alright. And then I will wipe this off.
So yeah, we wrote our own badge, and it's now available to all the other troops in the country. And I'm going to do the housekeeping one because these girls don't know how to do the dishes, let alone take care of a home.
Alright. And then my area is clean. Now I'm going to clean my instruments that were used in the surgery. I'll scrub them up first, and then I'll put them in our ultrasonic cleaner over there. So, just scrub any of the blood or body fluids on it that are on them. Scrub them off. They've been soaking just a little bit, not for too long. And these are just the tools that he used. So then I will turn on my cleaner and I'll let them sit about 10 minutes. And then I'll come back and I'll dry them and wrap them in the pack. Okay, so now that all my instruments are clean and they've been through the ultrasonic cleaner, I will take my Rochester Carmel clamps and I'll start to assemble my pack. But I start with those, and then I take my mosquito forceps. Make sure they're all unclicked so that the steam can get through. And I'll just put my regular forceps and my scalpel blade, and my spay hook and my scissors, they go next on here. Needle holder and my drape clamps. And then I will take one of my surgical blades, we use size 15 here, and my OK strips, sterilization indicator. Then I have a drape, just a regular drape we put in our surgery packs, already folded and ready to go. And then I'll take some additional 3x3s, set them up. I'll wrap one side and then the other, making sure it's as tight as I possibly can make it. That's my towel cover, and then I have my second wrap here. That again I will make as tight as I can. And then I will take my sterilization indicator tape. And I will tape it up, and then I will write on it what is in it. And the date, so we know what time or what day it got autoclaved. Okay, so now I'm going to show you how to fold and properly pack up a surgery gown. So this is the way we do it here. So I will fold in my arms, and then I will fold each side part way. And then I will accordion fold it so that when my doctor or one of the techs pull it out, it will fall nicely without getting contaminated or anything. And then I will take it over and wrap it like I did the surgery pack.
Okay.
Okay, so now that I have my surgery gown all accordion folded up, I will take my OK sterilization indicator and we'll put that with it. That way when we open it, we'll know if it's been sterilized properly. I will fold it down and make each fold as tight as I possibly can make it. Folding one side and then going to the right and then the left side and then the final side, and I will pull it over and tuck it in between my other two folds. I will take my sterilization indicator tape for the outside and I will tape it shut so that it stays, and then I will write on it what's in there, which is a medium surgery gown, the date that I'm autoclaving, and then my initials. Okay, so now I'm going to pack my autoclave. I already have some in there, but I have my surgery pack gown and a surgery brush that I wrapped. So I'll go ahead and set them in here. You want it fairly full, but not too full, because you want the steam to be able to penetrate all of the packs. Maybe I'll get the brush in there. And I will fill it with some distilled water. And then I will go ahead and turn my knob here to fill water, and I will watch it fill up to this line on the inside of the autoclave. And while that's filling, basically the way the autoclave works is it uses a combination of pressure, high temperature, and steam to sterilize all the instruments within the packs. So okay, so now my autoclave filled up with the water, the distilled water. So I'll go ahead and shut this and latch it. Crank it, make sure it's nice and tight. We run ours on between 250 and 270 degrees, and then we'll run it for about a half hour at 10 to 15 psi, kind of depends. And so I have it on STE, which means steam. And I will turn my timer on for 30 minutes. And in about a half hour, I will come over and put it on the dry setting and let it kind of dry itself out. And then the packs will be done. Okay, so now I'm going to remove a suture. Which is right here. My doctor does not typically do skin sutures, so he just placed one for me to remove for the purpose of this video. Typically, it's about 7 to 10 days after they're placed before we can remove them. The skin is usually all nice and tight, and you don't see any gaping or bleeding or oozing or anything like that before we would remove it. So I'm going to take my scissors specifically for suture removal. I'll come in, I'll find the side and put my hook underneath, and I will cut, and then I will gently pull it out. Okay, so this is our autoclave, and we get it serviced once a year, and then we have it cleaned out about once a month. where we'll drain all of the water out. We'll clean the inside, and then we have a rack that the packs sit on that we'll clean the inside of as well. And then we'll refill it with fresh water. We do that all about once a month. And that's kind of what our manufacturer recommends.